Let me ask you something. When was the last time someone checked your blood pressure and the number was higher than you expected? Maybe your doctor mentioned it casually and moved on. Maybe you've been monitoring it at home and noticed it creeping up over the past year or two. Or maybe you've been told you're borderline and sent away with a leaflet and a pat on the shoulder. Here's what that leaflet almost certainly didn't tell you. High blood pressure after 40 is not just about eating less salt. It's driven by a combination of hormonal changes, chronic stress, blood sugar dysregulation, and yes, even dehydration. Factors that are almost never properly explained and almost never properly addressed before medication is reached for. Today I'm breaking down exactly what your blood pressure numbers actually mean, what's really driving them up after 40, and the natural interventions that have genuine clinical research behind them, not just folklore and wellness blogs. Stay with me, because some of what's driving your blood pressure is directly connected to things we've already covered on this channel, and the fixes might be simpler than you think. Quick note, not a doctor, nothing here is medical advice. Always work with your healthcare provider on blood pressure management, especially if you're already on medication. Never adjust or stop medication without professional guidance. And stick around, because later in this video, I'm covering a breathing technique that research shows can produce a measurable drop in blood pressure within minutes. Okay? Let's go. Before we talk about causes and fixes, let's make sure we're clear on what those two numbers actually represent, because most people have had their blood pressure taken dozens of times and still don't fully understand what they're being told. When you get a blood pressure reading, you get two numbers. The top number is your systolic pressure. This is the pressure in your arteries when your heart beats and pumps blood out. The bottom number is your diastolic pressure. This is the pressure in your arteries between beats, when your heart is at rest and refilling. Both numbers matter, but diastolic has been getting particular attention lately, which is reflected in the search data. How to lower diastolic blood pressure naturally is one of the fastest growing blood pressure queries researches right now. Elevated diastolic pressure specifically suggests your arteries aren't fully relaxing between beats, which over time places chronic, low-level strain on your cardiovascular system. So what's actually normal? The current clinical guidelines define normal blood pressure as below 120 systolic over 80 diastolic, written as 120 over 80. Elevated is considered 120 to 129 over less than 80. High blood pressure, also called hypertension, starts at 130 over 80 and above. Here's the important nuance the leaflet rarely explains. Blood pressure naturally varies throughout the day. It rises when you're stressed, after caffeine, after exercise, when you're cold. A single high reading isn't automatically a diagnosis, but consistently elevated readings across multiple measurements, at rest, across different times of day, that's when it becomes something to actively address. Understanding your baseline is step one, which is why how to measure blood pressure at home is also trending strongly right now. A home monitor used consistently gives far more useful data than a single clinic reading taken when you're already stressed about being at the doctor. This is the section most people never get properly explained to them, and it's where the real leverage is. Because if you don't understand what's driving your blood pressure up, you're just guessing at solutions. Cause 1. Chronic stress and cortisol. We covered cortisol in detail in our dedicated cortisol video, link in the description, but its connection to blood pressure deserves its own emphasis here. Cortisol directly raises blood pressure through two mechanisms. It causes blood vessels to constrict, increasing resistance to blood flow, and it causes sodium and water retention in the kidneys, increasing blood volume. Both of these push blood pressure up. Chronically elevated cortisol, which is extremely common after 40, is therefore a direct and ongoing driver of hypertension that no amount of salt reduction will fully address on its own. Cause 2. Dehydration. This surprises most people, but it's well documented. When you're dehydrated, your blood volume drops. Your body's response to this is to constrict blood vessels to maintain pressure and blood flow to vital organs. This vasoconstriction raises blood pressure. Many people walking around with mildly elevated readings are simply chronically mildly dehydrated. Something as straightforward as consistently drinking enough water throughout the day can produce a measurable improvement. Cause 3. Caffeine. The answer here is more nuanced than most people expect. Does coffee raise blood pressure and does caffeine raise blood pressure are both trending strongly right now, and the research is actually interesting. In non-habitual drinkers, caffeine can produce a temporary but meaningful spike in blood pressure. However, in regular daily coffee drinkers, the body often develops a tolerance to this effect over time, and the research on long-term coffee consumption and blood pressure is actually more mixed than the headlines suggest. The bottom line, if you drink coffee and have high blood pressure, it's worth monitoring your readings before and after your morning cup to see whether it's affecting you specifically. Cause 4. Insulin resistance. We covered this thoroughly in our insulin resistance video, link appears above. But the connection to blood pressure is direct and important. Chronically elevated insulin causes sodium retention in the kidneys, which raises blood volume, which raises blood pressure. Multiple studies identify insulin resistance as a significant independent driver of hypertension. This means addressing blood sugar and insulin sensitivity is simultaneously a blood pressure intervention. They're the same problem viewed from different angles. Cause 5. Nicotine. Straightforward here, nicotine causes immediate vasoconstriction and is a well-established driver of elevated blood pressure over time. And we haven't even gotten to the part most people completely miss, because while salt gets all the blame, there are 4 other things quietly driving your blood pressure up after 40 that nobody's talking about. One of them is something you probably do every single morning without thinking twice. That's coming up right after this. A quick mention. If you like any of the t-shirts that I am wearing in the videos, designed by my wife Jill, they can be purchased from the Geek Your Health website, link in the description, okay? Let's get back to the video. Beyond the lifestyle causes we just covered, there are specific biological reasons blood pressure tends to rise after 40, and understanding them matters because it changes how you approach the fixes. First, arterial stiffening. As we age, our arteries naturally lose some of their elasticity. Younger arteries are more flexible, absorbing the pressure wave from each heartbeat more effectively. Stiffer arteries resist that wave, which pushes systolic pressure up. This process accelerates after 40 and is one of the primary reasons hypertension becomes dramatically more common in midlife. Second, hormonal changes. Estrogen has a protective effect on blood vessels. It helps maintain their flexibility and supports healthy blood pressure regulation. As estrogen declines during perimenopause and menopause, this protective effect diminishes. This is a primary reason why women's blood pressure risk rises significantly during and after menopause, often overtaking men's risk in the postmenopausal years. Testosterone decline in men after 40 also plays a role in cardiovascular regulation, connecting directly to what we covered in our testosterone video. Third, muscle loss. We've discussed sarcopenia, the natural loss of muscle mass after 40, in several previous videos in the context of metabolism and insulin resistance. But muscle tissue also plays a role in blood pressure regulation through its effect on blood sugar and insulin. Less muscle means worse glucose disposal, higher insulin, and as we covered in the previous section, higher blood pressure as a downstream consequence. Can it be lowered naturally? Yes, and the research on this is genuinely encouraging, particularly for people in the earlier stages of hypertension who haven't yet progressed to requiring medication. Multiple large studies show that lifestyle interventions alone can produce reductions in systolic blood pressure of 10 to 15 millimeters of mercury or more, which is clinically meaningful. In context, many first-line blood pressure medications produce reductions in a similar range. This doesn't mean medication is wrong or unnecessary. For many people, it's absolutely appropriate and important. But it does mean that for people in the elevated or stage 1 hypertension range, there is real evidence that the right lifestyle approach can make a significant difference without immediately reaching for pharmaceuticals. The key phrase is the right lifestyle approach, not just generic advice about reducing salt, which is only one piece of a much larger picture. Let's get specific. Fix 1. Breathing techniques. Breathing exercises to lower blood pressure and the viral 7-second trick to lower blood pressure are both trending hard right now, and the underlying science is real, even if some of the social media versions are exaggerated. Slow, controlled breathing, specifically extending the exhale to be longer than the inhale, activates the parasympathetic nervous system, reduces heart rate, and produces measurable reductions in blood pressure within minutes. The most researched version is a 4-count inhale followed by a 6 to 8 count exhale, repeated for 5 to 10 minutes. This isn't a cure, but it's a legitimate acute tool, and practiced consistently, it can contribute to lower baseline readings over time. Fix 2. The DASH diet. The dietary approaches to stop hypertension diet is one of the most extensively studied dietary interventions in cardiovascular medicine. It emphasizes vegetables, fruits, whole grains, lean protein, and low-fat dairy, while reducing sodium, red meat, and added sugars. Multiple large clinical trials show the DASH diet can reduce systolic blood pressure by 8 to 14 millimeters of mercury, a genuinely significant result from dietary changes alone. Fix 3. What to drink. Beyond water for hydration, two beverages have particularly strong research backing for blood pressure. Hibiscus tea, consumed regularly, has been shown in multiple studies to produce meaningful reductions in both systolic and diastolic blood pressure through its effect on ACE inhibition, similar in mechanism to a class of blood pressure medications. Beetroot juice is the other. The nitrates in beets convert to nitric oxide in the body, which causes vasodilation, blood vessel relaxation, and measurably lowers blood pressure within hours of consumption. Fix 4. Magnesium. We covered magnesium in detail in our magnesium video, link appears above, but its role in blood pressure regulation deserves emphasis here. Magnesium is essential for blood vessel relaxation. It acts as a natural calcium channel blocker, helping arteries stay flexible rather than remaining constricted. Magnesium deficiency is extremely common after 40, and multiple studies show that supplementing with magnesium glycinate specifically can produce meaningful improvements in blood pressure readings. Fix 5. Intermittent fasting. Can fasting lower blood pressure is trending right now, and the answer from the research is yes, and we covered exactly why in our fasting video, link appears above. By improving insulin sensitivity and reducing the chronic insulin elevation that drives sodium retention, consistent intermittent fasting can contribute meaningfully to lower blood pressure over time. Here's where we land, and your homework, and my top recommendation for most people because it costs literally nothing and takes 5 minutes. Tonight, before bed, try the breathing technique. 4 counts in through the nose, 6 to 8 counts out through the mouth. Repeat for 5 minutes. Do it lying down if you want. Check your blood pressure before and after if you have a home monitor and see what happens. Then pick one dietary change from the fixes above, whether that's adding hibiscus tea, getting a beetroot juice into your routine, or simply drinking more water consistently throughout the day. Small, consistent changes compound over weeks and months into real results. Drop in the comments, have you been told your blood pressure is elevated and what's worked for you? I read every single one. High blood pressure after 40 is not inevitable, and it's not something you just have to manage with medication and hope for the best. The research is clear that the right combination of breathing techniques, dietary changes, hydration, magnesium, and addressing the underlying cortisol and insulin resistance driving it can produce real, measurable improvements. If you want to go deeper on the cortisol connection, the insulin resistance piece, the magnesium research, or the fasting angle we mentioned today, all of those videos are in our channel. They connect directly to everything we covered here. I'm Nate, this is Geek Your Health. Check out geekyourhealth.com for more. There's a free guide waiting for you there. The 7 lazy ways to stay healthy after 40. Stay curious, breathe slowly, and I'll see you in the next one.